Welcome to Berkshire Senior Television. Our topic today is Meet the Director, and our guest is John Lutz, the new Executive Director of Elder Services of Berkshire County. I'm your host for today's show, Stephanie Talanian. Welcome, John.
Thank you, Stephanie. Glad to be here.
Well, so in your first issue where you did the editorial of Berkshire Senior Television, you were discussing topics regarding elders that really made it sound like someone who has somewhat of a background in aging services. Would you like to start by telling us about that background?
Well, I came from Highland Valley Elder Services. I was the executive director there, and prior to that I had been an associate director. So I had been with Elder Services in Highland Valley for 7 years. So I've gotten to know the system in Massachusetts. Prior to that I had no experience with the formal elder services system. I've worked in human services and other nonprofits for most of my career. But I've spent 7 years now in Massachusetts before I came to Berkshire County working in the formal elder services system.
And in that system that you were working in, you mentioned Highland Valley. Maybe some of our listeners don't really know the system and what it's about?
Sure. In Massachusetts, there are 27 ASAPs, is the phrase used, but they are Aging Services Access Points. And those are agencies, private nonprofits, that have been designated by the state of Massachusetts, by the Executive Office of Elder Affairs, to provide services to elders throughout the state. Everywhere in Massachusetts, somebody's covered by an ASAP. And they contract with the state to provide services such as elder protective services or home care services, caregiver services. The state contracts with local nonprofits to do that. And there are 27 of them in the state of Massachusetts, and we're one of the 27.
And we cover the entire region?
We cover all of Berkshire County, all 32 towns. So we probably have one of the largest number of towns that we cover, but not necessarily by population. But we certainly have one of the largest geographic areas of all the 27. Some of them are very small. Some of them are only 1 or 2 towns because of population. They're much smaller as you would guess, in the east.
Right. In that same article, you talk about challenging times and how services can be provided in those challenging times.
I think it is going to be a challenge, and not just kind of twofold. One is, as we know, on the federal and state level, funding for human services, social services, the social service network, and safety net is being reduced. Just from a matter of mathematics, less money is going to flow from the feds to the state, from the state to local entities to try and provide that safety net and those supportive services. The other part is we are, of course, in the elder business, and there are more elders, and there are going to be more elders coming in the next 10, 20, 30 years. And I think especially here in Berkshire County, proportionally, we have a larger proportion of elders to our population than in most of the state and actually in most of the country. So those dynamics are going to combine to create challenges. Less funding, more people, higher proportion, and that's going to create a challenging environment for us as a community in Berkshire County to make sure that we do provide services to elders equitably, and that elders throughout the county receive equitable services and equitable support. The simple geography of Berkshire County, that's a challenge. When we deliver Meals on Wheels, we average a lot longer distance to deliver that meal than they do in Somerville and Cambridge. So that's an added cost, added time, added logistics. So those kinds of challenges are going to be there as well.
So how does one accomplish the task at hand in those challenging times?
Well, I think it's being able to look kind of outside the box, as the phrase is, but not only to do different things, but to do things differently, and to look at partners maybe we haven't partnered with before, or to look at opportunities to build relationships with organizations that might have a similar mission but not the same, but there might be opportunity for collaboration, consolidation, cooperation, all those different things. I think it's going to be about how far can you stretch that social service dollar. And while those dollars might have been more plentiful in the past, as they've become constricted, we're going to have to be more creative in how we use them and how far we can stretch them. So, we are currently working with another Berkshire agency, AdLib, that works with primarily with disabled folks. But there's an opportunity to come along where we might be able to work together to serve a new population that's going to get services through the state for both Medicare and Medicaid eligible clients, and we might work together to try and provide those services. So, we might just have to look for new partnerships. As elder services, we might have to think about, well, what about serving those that are under the age of 60? And how can we do that to help support those services that we provide over the age of 60? So I think, the whole social and human service landscape is kind of evolving. At the federal level, they've taken 3 departments and merged them into one called the Administration for Community Living. Used to be elders, the disabled, and those that are developmentally disabled, and now they've put them together in saying, well, it's all about community living. It doesn't really matter why you have challenges, but those challenges are about keeping you living in your community in the least restrictive environment with the most independence. And if we can work with that with elders, then maybe we can work with that with other populations and other agencies as well.
How is the aging baby boomer population affecting the services provided?
Well, I think it's going to be continuing the challenge from a sense of, as we know, there's a large number of people coming that are aging. So just on pure numbers, there's going to be more people to serve, probably with the same or less money. So, as former finance director, that math doesn't work very well. But the other part of it is that someone that is turning 60 or 65 or 70 or 75 today has not had the same life experiences as someone who is currently 75, 80, or 85, and is not going to have the same life experiences those folks are going to be turning 60, 65, and 70, 10, 20, 30 years from now. So I think what's going to happen is that we're going to have to evolve our services and our supports to match a changing demographic and population of elders. So even though the federal designation of an elder is someone who's over the age of 60, and I think if we, in our own families, our own lives, we can think about, well, what was someone that was 60 or 65? What did I think about them, or what was their profile when I was a kid 50 years ago? What is their profile now? And well, what is it going to be, in 20 or 30 years from now? And the experiences and the health and the just well-being that people are going to bring to being an elder is completely different. The average age of someone on home care today is around 80 years old. I would expect that age is actually going to increase because people are coming to being an elder in a healthier, stronger mode, and often are working much longer today than they did 20 years ago, 30 years ago. So the whole construct of being an elder, regardless of the age, the age has kind of stayed the same, but that experience, I think, as we all can just look in our own families, our own lives, has really changed. And people are working longer, they're physically capable much longer, their health experience might have been much different, advances in healthcare, longevity, people are living longer. So I think it's just going to be a different experience for us in looking at and serving a different population, and likely at an older average age as the boomers come along. Because they've typically had a healthier experience, and the advances in healthcare.
I'm looking at thinking about myself as an elder and what I would want if I needed services at home. Even a simple thing like Meals on Wheels, that's certainly not my diet, eating a vegetable and a meat and a potato or whatever every lunchtime. Are you going to be looking at that and how that changes and evolves also?
I think we're going to have to remain relevant and important to our clients. And while we operate the Meals on Wheels program, which is guided by federal guidelines, and there's very strict about 1/3 RDA and all these things and federal commodities, so we do have some limits about what we can do. But I think what we have to think about is, but that meal plays an important role in that person and that person's family's life and their aging in place. So if we're going to retain that role, we may have to think about what we're doing with our meals to be more accommodating or to meet more dietary issues or just to be more attractive. And to say, well, we have people who might want less meat, or they might want more of that, or they might have ethnic concerns or cultural concerns. So I think as those numbers change, we're going to have to be attuned to that, because the role of the meal in keeping someone healthy and recovering and independent and living in their home and getting a daily wellness check from the driver, those things are not going to change. But if we don't accommodate the changes in our community, then they won't be as effective, because we won't reach as many people. So I think we're going to have to, if we're going to maintain the kind of effectiveness we have now.
What are the challenges do you see for elder services?
I think the challenges are to meet, in many ways with human services. Our challenge always starts with is to meet the individual where they are. What can we do? How can we help you have the highest quality of life, the most independence, and have the life that you want? And with elders, that can be particularly challenging. People have, they've had a lifetime. They're not children. They've had a lifetime. They've developed their own expectations. They're still perhaps living in the home they've lived in for years and years, and they're entering a different phase of their life. And there may be physical issues involved. There may be cognitive issues involved. But the challenge is going to be, as they change, how can we still provide what is it that we can do for you to keep you living as independently as possible, of your own choice, least restrictive environment, in the highest possible quality of life. So I think as elders change, that definition is going to change, and we're going to have to change with it. Otherwise, we're not going to really be serving the full population that we could be.
So you've been here all of 6 weeks?
Yes.
How are you balancing the daunting task of handling meeting the staff, meeting the community, and taking care of the everyday business of elder services?
Well, I think one thing that I've tried to do is to come in and just start where we are. This is where we are. We didn't get here overnight. We're not going to get out of here overnight. This is just the beginning, and we're going to take these steps. I've been meeting with community people. I've been invited to some things that I'll be going to and have attended already, working with our board. And I've been meeting with staff, either individually or in work groups, to just kind of see, where are we at? Because we can't go forward if we're not really sure, what those challenges are. So have really been trying to take that time. When you're new, this kind of like, once you've been here a while, you can't go back and say, well, now tell me what you look at it with fresh eyes, and trying to do that, and trying to use this, this initial period to really find out, where do we are in relation to the community, into relation to fellow agencies, into relation to staff, in relation to the board, and then be able to hopefully chart a course of, well, we have these challenges, and here's how we're going to work on that one, and here's how we're going to work on that one, and here's a collaboration we're going to look at, so that we can hopefully move forward. But it's it's an incremental process. It's not going to happen overnight. But as long as we're kind of headed in a positive direction, then I think we'll get there, and we'll be able to start expanding programs and start looking at new opportunities instead of just worried about where are we at and kind of getting reestablished, but actually look at where are we going next.
For those of you who have just joined us, this is Berkshire Senior Television, and today's show is Meet the Director with the new Director of Elder Services, John Lutz. So how does the rural nature of Berkshire County affect the work, maybe differently than if we were not so rural or when we're in the city?
This is always a huge challenge, and always one of conversation to try and get my colleagues who are in the inside the 495 Beltway to understand the unique challenges of being in a rural area. And I think it's both a positive and a negative. I mean, the challenge is often just the logistics. That adding one more home delivered meal person to a meal route might mean driving 10 more miles. Out and back 5 miles, because that's the next house. So, just from a administration and logistical and cost, it's more expensive to provide the same services in a rural and geographically diverse area than it is in an urban and very compact area. We have fellow agencies in urban areas that might have 150 clients in one building. And they send one person and they can handle, and so it's a lot different. That's the kind of the logistical challenge. I think from a service challenge, it's about making sure that we are sensitive to the isolation that can happen, in a rural area, to the challenges of weather and construction and financing. We have many elders, especially in rural areas, that are the classic house rich and cash poor, because they live in a house, they've paid for it, they live there all their lives, but they can no longer manage the property, or they can no longer manage the house, and they're isolated, and their neighbors aren't very close by. So